Hey, good morning, everybody. Sarasota Tim coming to you from beautiful Sarasota, Florida here. Another cool morning. I think our weather's finally broke. I'm loving it. I actually had to run my heater this morning. I live in a travel trailer, a 25-foot Flagstaff 2024 model, beautiful camper, and I love it. And I'm retired. I'm 65 years old. I started getting my Social Security at 62. I'm a big advocate on that. I have lots of videos, even a playlist on my channel that talks about why I believe everyone should collect Social Security at the first possible date, and that's the age of 62 years old. Check those videos out. Today's video, however, is relevant to retirement, and it's about your Medicare. When you go from 62 and you finally reach 65, you can't get it at 62 when you get your money, but at 65, a second stage comes in, and it's called Medicare. And you can get it for free or you can buy it. There's only two choices. I'm going to go over them as simplest as I can understand. That's what Sarasota Tim does. He brings you the facts, he brings it to you simple, and he brings it to you direct. Okay? Now, I'm 65, let's say, today, and I contact the Social Security Administration. They'll probably contact you first, especially if you're already on Social Security. And what they're going to tell you is not very good news for some people. Like, it wasn't good news to me because I don't have millions of dollars in the bank. I don't have a pension. I don't have a 401. I didn't get a retirement check from a company I worked for. I worked for myself all my life. I only got my Social Security. Now at 65, Social Security says, heads up, we're going to implement Medicare, and there's what they call Part A and Part B. And there's a cost for Part B that all Social Security retirement recipients have to pay into. And it's gone up over the years, and I think in 2024, it's about $164, $165. Let me just round it up. And next year, they've already told us of how much more we'll get on our Social Security checks, and also how much more we will have to pay for the Part B Medicare that comes right out of your Social Security check. So if you made $1,700 a month, now you're going to get $1,500 a month because it's about $200. They're going to raise it to $175. It's just under that, but I'm rounding up. So, wow, I got Social Security for 3 years, and then bang. And instead of Social Security going up, because it never does for 40 years, we've never gotten anything significant to brag about, except for 2 years ago. We got an 8.7% increase, which bumped mine like $150, and a lot of people approximately that. And it was like, wow, $150 more, which was kind of a joke, but it's still every month for the rest of our lives versus the $20, $30, $40 like we're going to get next year. And then they raise that Medicare Part B up, and then you end up taking another $10 off of that, and it amounts to nothing. But we will always take it because, like I always tell people, if I called you up and said, you know what, I'm just going to send you $25 every month for the rest of your life, in addition to whatever you got coming in, you'll say, fine, I'll take it. So we will take it, but it's absurd of how little they say and believe the inflation has gone up to give us a measly 2.5%. They admitted it during the pandemic and gave us that 8.7. But since then, as things have exponentially gotten higher, there's no way that you need more than 2.5%. So that's another story. But anyway, when I was 65, got my check, 3 years went by, I had a certain amount, then my check went down. Was going to go down. But I made this decision, and this is what I want to share with you in this video. When you become 65 and you get your Medicare, I mentioned earlier there's two Medicares. There is the traditional Medicare of where, sorry, my eyes got something going on. There's traditional Medicare where Medicare says, hey, if you would like to buy a Medigap plan to supplement your Part B that you're paying this $175 for as of 2025, to pay the difference, you can buy it. And when you buy it, it's so good. It's called a G plan, and that's kind of the most popular one. And that G plan is the same coverage for anybody that gets on Medicare that buys a G plan. The only difference is shop around, because different companies will charge you a different amount. And whatever they give you this year or what you got for your G plan last year may go up, or it may have gone down, or the other company that you don't have could have gone down below what you're paying. And what people will do is they'll get on it. They're 70 now, and they never, even check it. They just keep paying it. Let me back up one step. The reason I'm making this video, folks, is a couple of days ago, as I thought I mentioned, we are in open enrollment. This happens once a year. This is your chance, and you got quite a bit of time. It just started a few days ago. It begins every year after they announce how much we're going to get on our Social Security increases. The insurance companies allow you to switch your plan, your health insurance, to different plans, different companies, back to traditional Medicare or Advantage plan, which I'm going to go over in a minute. And it starts October 15th every year. So what is today, like the 18th or 19th? I think it's the 18th. So we've only been a few days into it. And it lasts until December 7th. So you have a lot of time. So there's no reason that you don't need to call, not your agent. You don't have to worry about reaching that person 100 years ago that you signed up with or last year. You just simply call a Medicare agent. They are regulated and can only, most of them can do the same thing. They all can do the same thing. Now, some, if you go with the Advantage plan, cannot sell you Advantage plans in every state because they're in a different state. But that's not a big deal. You just find somebody that there's commercials on TV. Just call any of these numbers. They take you to agents. They get paid from the government to help you sign up. But let's say you're already signed up like me. This time period, you say, well, I did that last year. I'm on Medicare. What do I need to listen to this video for? You do, because if you're on a traditional Medicare plan, that's the first plan. Let's back all the way up. Remember, there are only two. We're going to talk about one. And each one has as many recipients as the other. No one plan is better. Don't let anybody fool you. I have a different opinion, but I'll say this. Everybody can't be wrong, and we got half of America over here and the other half of America over here. It's pretty much down the middle. And there's a reason for that, and I'll go over that in just a minute. Plan one, that you buy it. It's going to cost you money. Not only did that Part B start taking effect and your Social Security check went down, now you are forced, unless you're still working in a company that has several employees full-time and you have an insurance group policy. I think it's 10 or 20 full-time employees, and you have to notify Social Security about this, otherwise there's a penalty. But that's another story too. Let's say that you've retired and now you're going to get this Medicare. Well, you got to buy it. It isn't free. Number one, they just took $200 from your Social Security check because you're now must take Medicare, and you have to choose one or two. Let's stay on the one. I know I ramble. The one that you pay for is Aetna, Humana, the AA, AAA. It's also known as, there's several companies that do it. And they both represent both plans, the Advantage plan and traditional Medicare. So you buy it. How much is it? Well, you're going to want to get the G plan, most likely. And that's the plan that everybody thinks it's so great, that's got a lot of money, because you get it, you get the G plan, and you let them take your money out of your Social Security, and then you pay Aetna or Humana or whoever money for this health insurance, and you get this little card, and any doctor, any swinging door around that takes Medicare will give you services. And aside from a tiny, small deductible that's hardly worth mentioning, annually, you'll never pay a penny. Everything, for the most part, you will never really worry about paying any medical bills. Except small details for the insurance. You have to buy it. You have to buy it every month, rest of your life. And you have to lose the Social Security amount out of your Social Security check. So you take that amount and what you're paying for that, and you put that together, and you've got now a bigger amount. Now wait, the fun's not over. Traditional Medicare only includes, if you buy it, the insurance, the health insurance. Doesn't include your prescriptions. Part D, drugs. You have to buy for $15 to $35 a month another insurance policy. Add that to the list. Wait a minute. Gym memberships, not included. Hearing, nope. Dental, nope. Vision, nope. All of those things are free under that other policy that I'm going to talk about in a minute, including the drugs. So the amount of money you pay out of your Part B, the amount of money you buy all of these policies for, comes to one number, right? You get to the bottom line, Baker. And that's about $500 a month between the $175 they're going to take out of your Social Security and the other $300 on average it's going to cost you if you were to buy vision, dental, health, hearing, and drugs, plus an insurance policy called a G plan. G plans can be procured in some states that have lots and lots of doctors and they don't have, whatever the reason is, that much of a cost. And other states can be extremely exorbitant for the cost of a G plan. But remember, a G plan is a G plan is a G plan. It doesn't matter what you pay for it. You get the same coverages wherever you go nationwide. There's no network you got to stay in. There's no fencing around you. You are a free bird. All you got to do is give them $500 a month. Sound like a deal? Well, let's say you can get it for cheaper, because I can hear the pushback already. You're not going to get away from the $175. There's no, this first plan I'm talking about, there's no way you can escape that. So you're going to lose your Social Security close to $200 for the rest of your life. Then all of these insurances, if I'm a little high on the number I gave, it isn't much cheaper, especially if you get all the things that you might need, like the vision, the dental. You got to have a drug plan and all of that. So you can put whatever number you want, but it's about $500 a month. Times 10 is 5,000, and then there's 2 more months left, 12 months in a year. That's another 1,000. That's $6,000 a year. Let's give you the best deal you ever had in your life, and let's say it's only, $4,500 a year. Do you want to spend $4,000 to $6,000 a year for the rest of your life for insurance that you may or may not use several years in a row, ever, once or twice, but you're still shelling out $4,000 to $6,000 every year? What about option 2? That's the plan I'm on, and that's the plan that the other half, in fact, it's the majority of the other half of our country, of retired people that are over 65, choose. And that's called the Medicare Advantage Plan. And every time I make one of these videos, or anybody, they get pushback about, let me just tell you right now, I'll just be right up front. Here's what they're going to say. They'll let you die. You will never get a coverage because the doctor has to get pre-approval. And you'll be laying there on your deathbed and you'll expire before they come back and say, go ahead, fix him. No, they won't approve the drugs you need. They won't do the surgeries you need. They won't give you this. They won't. BS. They will do and cover all the same things Plan 1 covers. The exception is because it's free. There are some you can pay for, but most of them are free. And they include the drug plan for your prescriptions, the hearing, the dental, the vision, and free gym memberships. So you say, why do they want to do all that? Why is it free? Why would I even think about paying for one that's free? Here's why. The other one, remember I said you have a very little small deductible every year that's hardly worth mentioning, and everything else is paid. Except the $4,000 to $6,000 that you pay every year. The free plan is there could be a cost sharing. There are co-pays. There are certain parts of your prescriptions that may not be covered 100% if they're a very expensive one. You know, they can your Medicare insurance helper on the phone, if you tell them what medications you're taking now, they can select an Advantage plan that the prescriptions are covered, or the most part of it. That's what I do. That's what they'll ask you too. They're trained to ask you. They will help you so much. It takes just a few minutes. All right? So, well, how much is it going to cost me? I get it for free, but what about all these doctor bills? First of all, you only pay the negotiated amount that the doctors and the hospitals, that the government pays them. And any portion or copay or portion that you would pay, which generally never comes into play, unless you have some serious thing. And it's a limit. It's called MOOP. It's an acronym that means most out of pocket annually. I'm with Humana. They don't amount to the $4,000 to $6,000 a year in general. Some can go over, but don't confuse this out-of-pocket cost that you might have, that you got to start paying that day one. The day you go to the doctor and you haven't reached your out-of-pocket annual thing, this is what confuses people. You only pay any portion that you might have to pay, and I never pay anything hardly. Never really do. I'm paying a little bit now on these eye drops that I take. I have glaucoma, and I go to an eye doctor. I pay him a little copay. Most copays are $5 to $45 to see specialists. They were $15 on my last policy. This one did go up, but I have a lot of other benefits that increased. So, and then I get all my drugs for free, but there's a couple of eye drops I take that one costs me $40. And let me just show you. These things can cost as much as, like any drugs, $400. And I pay $40 for that one. I got another one that I pay just under $100 for. It's very disturbing to me that I have to take these the rest of my life and that I would have to pay that every month. So during open enrollment, I have a very good plan. I'm probably not going to change, but I am going to call and say, look, I got some new prescriptions. Maybe you got new prescriptions that came out last year at your doctor that you're having to pay for, and you want to see if you can get another policy with an Advantage plan that will cover those. Before I confuse you, let's get back to the Advantage plan. So all the scare tactics that people like to say, that have all this money in the bank, they got a pension coming in, they don't care that they're spending, they don't care about losing the $200 out of their Social Security, they got plenty of money, they don't care that the insurance costs money, they don't care if they got to buy drug plans, they don't care if they get a gym membership, they can buy their own, they don't care because they got money. They got plenty of it. They can never spend it all, I guess. But people that are watching their money, that need insurance, they'll do the same exact thing. You need a heart, a liver, a gizzard, a knee, a hip, an eye, a finger, a glaucoma surgery, some eye drops, a dermatologist. You want to go get your womanly things done? Whatever your needs are, you got coverage. It works. And chances are, when you incur like a small copay, which you don't get with that G plan, and these things, they don't break the bank because you're not paying $400 to $500 a month for insurance. And here's the bonus. This is not true. with every Advantage plan. I get $174.70. Oh, also this dental thing, I get $1,000 this year. I think it's going to be more next year, but I have that to use this year. I'm on a Humana plan. What that's saying right there, folks, is that $200 at $175 that are going to take out next year. Is it $165 this year or $175? Anyway, you can't get back more than they take out. But that part they started taking out of my Social Security at 65, I've never seen it come out because I'm on an Advantage plan that puts money back into my Social Security. Humana pays my Part B, all but like $10. They don't send me a check every month and say, hey, they took it out of your Social Security. Here's your check. It's kind of like getting it back. No, they call the Social Security office, and the Social Security office eschews it. It doesn't even come out. I still get my whole 17 hundos. That's fantastic. That's $2,400 a year almost that I'm not spending, that I can spend on any co-pays or whatever with this policy. Now, I'm a relatively healthy guy. Hopefully you are too. Maybe you don't even need to go to a doctor for a year or two. Maybe you don't even go for 5 years. Or you go once or twice. You get some blood work or whatever. They all cover all that. There's no charges for that, physicals and stuff. And they give you these free gym memberships because they want you to stay healthy, so they don't have to pay for expensive health issues. So, and there's even ways you can get money. Most of them give you money in a way of a debit card or on file that every quarter you can go out and buy aspirins, lotions, Vaselines, heart monitors, blood pressure monitors, anything to do with health. All the things the drugstores sell, free money to buy these things. Toothpaste, Q-tips, vitamins. I got $200 of the stuff I just received that are in my medicine cabinet, a blood pressure monitor, everything. Vaseline, Q-tips, I bought it all. All the things that I would use. And you're saying, what's the catch? You're getting all that for free. You don't pay for the insurance. And they even pay your Part B for you. They give you all your money back that everybody else in the country that's on the other plan has to pay. What is the catch? There's got to be something. Here's the other two things that are different. Okay, when you worked and you had health insurance that you thought was so important, and that's why you may not want to collect your Social Security until you're 65 because you're so worried about not having health insurance. I never was. I took it at 62. And there wasn't anything out there. What am I going to do? I'm not going to let $100,000 sit on the table that I didn't collect my Social Security for 3 years. So, or whatever it totals up to. When you're on the Medicare Advantage plan, you can't just go to any swinging door in the country. You got to go just like you did when you worked for that ABC company over here down on A Street for 30 years or 10 years, wherever you had your health insurance. You got to go to a network where you're got a fence around you. Only these guys. But there were plenty of them. There were plenty of eye doctors, heart doctors, primary doctors, dermatologists, whatever, gynecologists, all of these doctors. It's not like there's only two. There was plenty of doctors. So you have to go. And that means if you're out of town, you got no doctor. Except in an emergency. And you're 100% covered. 100%. But it better be an emergency. I mean, if you're just feeling a little ill and you need some antibiotics, go down to urgent care and pay $50 or $100 and get you some. If it's a virus or something like that, there's no cure for that anyway. But if you got something going on, And if you can't get home right away to see your doctor and you're miles away visiting a friend or relative or you're on vacation, you have to come up with a little bit of money and just go to an urgent care. But if it's an emergency, you'll be covered. But if it's just a little minor thing, you want to see a doctor, you're not covered. Except you get the Tim plan. Sarasota Tim found out that the Advantage plan that does all those things we just talked about also has, this is what I just described to you was an HMO. And when you work for somebody, you have those as well. You have HMO and PPO. PPO is preferred provider, and HMO, I don't know what it means, but you can only go to these. And with PPO, you can go to a little bit more of these, still within the network. Remember, only that G plan on Plan 1 is the one that you can go to any swinging door in America that accepts Medicare and walk in and say, throw down your card and not pay anything except that small once-a-year thing. Except for your drugs, your hearing, your dental, and vision and gym memberships and everything else. But remember, you're still paying $400 to $600 a month between losing your money out of your Social Security and what you're paying that insurance company every month for that coverage. So you're paying it up front whether you use it or not. I'd rather pay it as I need it. So with the Advantage plan, you do have this network. But I found out about Advantage plans have PPO plans. And I still get the money back on my insurance, on my Social Security. And I go from 2,500 providers that are within my zip code, which is where they'll put you. Wherever you live, they'll say, where do you live? And they're going to say, all right, you want the Advantage plan, you want the dental, hearing, drugs, and all that, your gym membership. All right, we got you. You want it free? Okay, we got you. You want money back in your Social Security so you don't have to pay that? Let's check. Now, that can only be $50, could be $100. It could be no dollars. Forgot to mention that. Not all of these Advantage plans, don't go there, give you money back. I'm very fortunate living here in South Florida. I guess there's lots of doctors, and the last place I lived, I got it, and this place over here on the west coast of Florida, I got it. Not everybody that gets an Advantage plan, like in Kentucky, let's say, I don't know, they will not get it. They may get $50, but whatever they will give you, if they have a give back program, take it. But at least if you have to still pay the $175 or almost $200 out of your Social Security, the Advantage plan is free, the policy. And then you just have to incur any co-pays and co-shares depending on how much you use it. And it really, you got to remember, folks, it's like life insurance. You got to die to get it. You got to get sick. You got to have something wrong with you for any of these things to cost you anything or to work. Now, most people do everything they can every day to eat right, live right, exercise, and not get sick. But of course, that's what insurance is for. Like for our cars, you never know. But if you never know, why just pay and you're not using it? Why don't you just take a plan that you pay when you do use it? And so back to the PPO. I found out that my plan with Humana, and it might work with other companies too. You don't have to go with Humana, but you can ask them about it. Not only do I get the give back program and giving me all my money back in my Part B, I also found out through a friend of mine that has it, that Humana has a PPO where you go from your little fenced in area around your zip code where you live to the whole country. From 2,500 providers to 55,000 providers. I mean, that's kind of like almost like the G plan. I mean, if you can't find a doctor that, personally, I go to an eye doctor or I go to a dermatologist, I figure they went to school. I figure they all pretty much know the same. I know there's different levels or whatever. All these people that get all hung up about, I have to have a man, I have to have a woman, or I have to have somebody that somebody said was extra great. Sometimes when you call a dermatologist, like I called one, and they said, oh, you HMO or PPO? I said PPO. They go, you're in, but they don't take the HMO. Some of these doctors are greedy. They only want to get, easy payments. That's another story. We'll talk about the fraud in Medicare one day. It's billions of dollars. These doctors are billing our government billions of dollars for people coming in with that G plan that they have carte blanche. They pay all this money. They never pay anything except that tiny deductible every year. And the doctor says, yep, you need these pills, you need this operation, you need this. You got good insurance, right? You get that G plan? Oh, yeah. And we're going to fix you right up. We're going to do this. We're going to do that. We'll get you that new hip, that new eye, that new leg, that new gizzard. And the third leading cause of death in this country is going to the doctor from medical errors, surgeries, wrong medications, all these different things these doctors are doing in hospitals are killing us. Third to heart disease and cancer. Google it. So I took the Advantage plan because I get money back in my Social Security and I need every dime I can get. And then I liked all those other benefits, free medical, hearing, dental, vision, my free gym membership. I go to the gym, doesn't cost me anything every month. That's $120, $200 a year or something that I would have to pay. Car insurance has gone up. That pays for a lot of my car insurance. Everything adds up, folks. And I'm still covered. And now I can travel because that's what I do sometimes during the year as a YouTuber. And I don't have to worry about being out of my network. If I have to go see somebody about my eyes, I have 55,000 providers, of which my free insurance, the Advantage plan, will work anywhere. They still have what they call an out-of-network, where if I choose to use a doctor that's not in my network, it'll still be covered, but a cost share I'll have to pay. Well, I'm never going to do that. I'm always going to find a doctor that went to school, that's a doctor, to do it for the free cost. Okay? So, it's open enrollment. I'll finish the video by saying this. If you're already covered with insurance, you can switch from one to the other, from the other to the one. Or you can stay with what you have, but call your broker, call any broker, Medicare broker on the phone and say, this is my plan. They can look it up. You give them your plan ID, that little card they give you for your wallet. You give them that little number. You give them permission to do it. They look you up and they say, all right, you can be cheaper. You can go with this one that puts money back into your Social Security. Now you just got your same insurance coverages and you get money back. Or you can go like I did from HMO to PPO free, still get more money back on your Social Security and go to any 55,000 different providers. I just can't even believe how lucky I am. I've never had more than $25 come out of my Social Security for Part B. And when I moved over to the west coast of Florida in Sarasota, I got even more on the Give Back program through the same company that just offered a better plan in this area. So, like I said earlier, you may not get a penny on the Give Back, but the insurance, the Advantage insurance plan, that people like to call the Disadvantage plan, and I call it that too as a joke. If you get the Disadvantage plan, that's always going to be free. There are some that you pay for, but don't go for those. Get the free one that gives you all those things. And if it doesn't give you any money back into your Social Security, so be it. But that's all you'll pay, that most people can't really get out of. Only very few people are getting this up to $175. Remember, just because they don't give you the $175 like I'm getting, maybe they'll give you $100. Maybe you'll get $75. I lived in Jacksonville, and I called them, and they told me that the $150 or so I was getting over on the East Coast in Palm Beach County, Florida, was going to go down to only $100. But I thought, well, that's kind of a bummer, but I'm still getting $100 put back into my Social Security. But just remember, you might be in a state where you're not in Florida, or a zip code, even in Florida, that has that. You got to ask them. But check out to make sure if you have the G plan, the first one that you're paying $4,000 to $6,000 a year. Call them anyway and say, I'm tired of paying all this every year. Put me in an Advantage plan. I'm done. Or, am I getting the G plan? I got plenty of money, but I would still like to save. Am I getting the G plan that's the cheapest? Because remember, when you throw down your carte blanche card of your G plan, it doesn't matter if you switch that company to this other one. You're still going to have all those same coverages of no cost. But wouldn't it be nice if you found out that the $300 a month you're paying Aetna is $250 a month or $200 a month with Humana or whoever else? AAA. AAA is not the insurance company. They own them. United Healthcare. That's a big one. But see if you're paying the least, if you get the G plan, and stay with it if you like it, and you still get the same coverage. Same coverage. You're not going to pay anything more. You can go to the same doctors. It's just that these insurance companies are raping people. They're charging them different amounts. And they go up. What you had, have you been notified? Have you been on Medicare for a while? And have you been notified, hey, next year it's a little bit more money? Well, in that case, let me call my broker and see if somebody else went down. Because it happens. So check that out, number one. That's the point of this video. And number two, if you're ready to enroll, this is the time to do it. It will take effect January 1st. If you're already enrolled and you have the Advantage plan and you would like to go to the $4,000 to $6,000 a year plan, you can do that too. However, there's a catch. You can switch, but the people that don't want to charge you anything, you can't just roll over into that if you have serious health issues. There will be a health questionnaire. I wouldn't think that cholesterol pills or blood pressure pills are going to exempt you from switching. But if you've got a history and it's all on record, just like your credit report, that you've been to the hospital and you got serious issues and you've been in an Advantage plan and there's some cost that are incurring, but they're not anything that you can't work out, something with the hospitals and stuff. I don't know of anybody that's, I know many people had heart operations, pacemakers, open heart surgeries, hundreds of thousands of dollars supposedly, because they charge $50 for one aspirin. So their numbers are already off the charts. Whether it really costs that or not, who knows? These doctors make a lot of money. But they never paid anything other than their deductible or their MOOP, their maximum out of pocket. Now let me just share one thing with you, because it gives me a very good comparison. They give you this every year. You probably received one. Annual notice of changes. Please endure me for one more second. I won't go through all of this. I just want to show you what they sent me. It's so simple to understand. It says right here. Should have had the page open already. It says, okay. Look, it gives you a comparison. 2024 and 2025 next year. It just goes right down the line there, showing you over here what you pay now and what it'll be next year. So I know if I want to switch. And it says that these are all different. Okay, here's the deal. My MOOP, maximum out-of-pocket amount. Remember we talked about that? Let's take a look at that. There you go. My maximum out-of-pocket is $6,500 currently. And if I, from network and out-of-network providers combined, can be $9,550 that I could pay if I choose to go to somebody out-of-network. I never would. And that's only, if something major happened, and it's a cumulative thing. It's not all one shot. It's if you have to go all year, and you had to keep doing these major things over and over and over, it could totally get to a maximum out of pocket of that. So don't think that if you had this major thing, the first $9,500 or the first $6,500 are going to be out of my pocket. It doesn't work that way. And it says, look, next year, look what's changing. I'm going from $6,500 to $67,000. It's going to cost me $200 more. Ooh, but wait a minute. From network and out of network combined, it dropped from $9,550 to $67,000. There's no more. That's the maximum. even if I go out of network. That's amazing. Let's just give you one more example here. Doctor's office visits, if they all go from the same, $0 for primary and $45 for specialist. I see an eye doctor, and when I go in, it's $45. Well, it's not cheap, but it's not a lot either. And next year, that stays the same. These are all, oh, here's one. Inpatient hospital stays. It's going to go from $305. I have to stay in the hospital. That's a major thing. This is you're not just going to go home. You got to stay here. Oh, okay. What's it going to cost me? It's going to cost you this year $305 per day for 7 days. If I'm in there for 2 weeks, I'm only going to pay for 7 days. Next year, they bump me. $350. $45 more. Well, they'll have to take the payment plan, because if I have to, maybe you have it. You just pay it. What can you do, right? That's if you got to stay in the hospital. Outpatient, there's nothing. Okay, drugs. Part D drug prescription. In network, $350. During this stage, you pay $0. Sharing for drugs on tier 1. See, they rate drugs tier 1 through 5. So you get an aspirin, hey, they cover that. You get a, insulin or some major drug, there's a cost share. And there it is, $47. That's what I'm paying. I didn't even see this. And there's a deductible of $350. So this, I didn't even know that. That's good news. That $100 I'm paying for that eye drop and $47. Once I reach $350, except for insulin products and most adult Part D and vaccines, your cost for covered insulin during this stage, you pay $0. So apparently it goes away. And then next year, look what my deductible is. $0. Maybe I won't be paying for these eye drops. I'm getting stoked by making this video. I'm going to end it now. Let me just show you one more thing. Okay, so that's the Part D stuff. That's the Part D stuff. And there was more down here at the bottom that I need to look at. And here's the... oh yeah, here it is. Changes to benefits and costs for next year. The monthly premium. You must also continue to pay your Medicare Part B premium. In 2024, your plan will reduce your monthly Medicare Part B premium by up to $164.90. That's what I'm currently getting put back into my Social Security. Your plan will reduce your monthly Medicare Part B premium in 25 by $174.70. So I think it's going to be about that or $185 next year. So because they can never give you more than Medicare takes out for your Part B. But wouldn't that be great? I'm not sure what it is next year, but if that's all it is, I'll be paying nothing. I'm getting all my Social Security money. This is the Medicare Advantage plan, folks. The Disadvantage plan, I should say. In-network maximum out-of-pocket. Okay, $6,500, $9,500, and then back to that $6,700. Once you have paid $6,700 next year, out of pocket for any covered Part A and Part B services, you will pay nothing for your covered Part A and Part B services from network providers for the rest of the year. So the most I can pay is what most people are already gonna pay, even if they don't go to a doctor, for the G plan. So I mean, I'm gonna rest it right there, folks. I just don't understand how anybody, I don't know. If I had more money than I could spend, sure, sign me up on the G plan. Forget about maybe that doctor doesn't cover it, or maybe I might have to come up with $6,700 cumulatively. That $6,700, folks, is annual. You may only pay $1,000, $500, $200. that year. That's the maximum. You don't, I said it earlier, when it's something that you got to be a cost share in, that doesn't mean you pay all of that up to $6,700 on that bill, on that visit. It's cumulative. It goes in baby steps. Just like my drugs. If I keep buying them eye drops every month, when I get to $350, I guess I'm done. So I'm only incurring that little cost now. All right, so that's it on the Medicare video. Hope it wasn't too long, too confusing. I just implore you to, at least if you already have it, to make sure you get the lowest price that you're paying for your G plan, or you have the most give back, or some other plan that will give you a give back if you're on the Advantage plan. Or maybe you would like to say, you know what? I came into some money. I don't have any health issues. I've only been on the Advantage plan for a year. I'm living in Bullhead City, Arizona, where there's not very many doctors here, and I'd like to go to the G plan now, and I can travel over to Vegas for an hour and a half, or I can go to Kingman, or I can go to somewhere else where there's more doctors out of my network, and I can have coverage, and I'll be good. Or I have the Advantage plan, but I'd like to switch it from HMO to PPO, where I can still travel to Vegas or Kingman or somewhere else if I lived in Bullhead City, or in BFE somewhere. And you want to be able to go somewhere else that's within network, but have a lot more providers. So there's a lot of options there. You need to call your insurance agent, a Medicare insurance agent, on the phone. Any of them can help you. And it is the time to do it now. You can only do this now through December 15th. December 7th. Correction. I always get those two dates wrong. It started October 15th, runs through December 7th, becomes effective January 1st. I'm not changing anything. I just went over my policy with you guys. I'm keeping it there. I'm definitely crushing it.